Hi, my name is Rick Olderman, and I'm a physical therapist here at Body and Balance Physical Therapy here in the Highlands of Denver, Colorado. And today's tip is about a nasty little habit that people have of locking their knees. Now, locking the knees may seem like an innocuous little thing, and however, it creates a lot of problems in the body. So what I mean by locking the knees is when you're standing and you shift to one leg and you kind of tend to lock that knee out to straighten it out to support your weight on it, that's knee locking, and that creates a lot of problems. And if we do that often enough, oftentimes the knee becomes a little hypermobile and locks a little bit too far backward, and it strains the tissues in the back of the knee. So that's one reason why knee locking is bad, but it creates a whole host of other problems. So here's what I mean by this. When our knee is bent like this, all right, we get to use our quadriceps muscles and our gluteal muscles, and it takes a lot of strain. Our pelvis gets a lot more freedom of movement here. However, when our knee locks back like this, it tends to produce this anterior tilt or this forward tilt of the pelvis and locks it in. And so what happens is that not only do we get stress to the back of the knee, but it turns off the gluteal muscles and it turns off the quadriceps muscles here. And this pelvic positioning also can generate a lot of pain in the back here, and the pain can either be on one side or both sides. So from an innocuous little habit like just locking the knees a little bit when you stand to take some pressure off your legs, a lot of problems happen, especially over time when you do this again and again and again. And so what happens is often with a lot of people is they do this so often that they start walking with their knees locked as well. And so it creates a whole host of problems in not only the foot, but also the ankle, the knee, the hip, the pelvis, the back, and so forth. So if I can tell you one thing today, try not to lock those knees when you're standing around. Start softening them a little bit, and you'll notice that some of your pain may start to ebb away.